patients to describe a burning discomfort in their chest and upper abdomen because of esophageal irritation caused by acid refluxing into their esophagus. Typical symptoms of acid reflux include a burning pain in their chest after meals. There may also be intermittent hot, acidic, or even bitter taste in the back of their throats. Patients may complain of a temporary difficulty with swallowing or even a feeling that food gets stuck in the middle of their chest. Often the pain is worse when bending over or lying down flat. Heartburn must be differentiated from acute cardiac ischemia, in other words, a heart attack, as both can cause severe retrosternal discomfort. The biggest difference is that a heart attack often feels like a tightening and pressure in the chest, as opposed to heartburn, which feels more like a burning sensation. Heartburn is caused when the lower esophageal sphincter doesn't close adequately while there is food in the stomach, and therefore gastric juices containing acid are being produced to digest the food. Heartburn may be a symptom of gastroesophageal reflux disease, and this should be considered if the symptom becomes regular and doesn't resolve with conservative treatment measures. There are food types known to relax the lower esophageal sphincter and therefore promoting heartburn. These include tomatoes, citrus, onions, chocolate, coffee, alcohol, and fat-rich foods. Activities which are associated with the development of heartburn include eating immediately before bedtime or when about to take a nap, smoking and vaping, wearing tight-fitting clothing, pregnancy, constipation, using medications, especially non-steroidal anti-inflammatories, and people who are just very stressed. The symptom of heartburn must be investigated if it doesn't have the mentioned typical symptoms, is a pressure or tightness, is associated with vomiting blood or so-called coffee grounds, there is fatigue or weakness, as this may be a sign of anemia, or no response to conventional over-the-counter medications. Conservative measures which usually resolve heartburn include eating smaller meals and not eating within 2 hours of going to bed or taking a nap, avoiding foods and beverages that cause the symptom, eat slowly, don't smoke or vape, and try maintain a healthy body weight. If symptoms are worse with lying flat, advise them to raise the head end of their bed by 10 to 15 centimeters. Over-the-counter medications that can be used as required include antacid medications such as Gaviscon or Amphogel or similar alginate liquids, as well as antihistamines, though they may have a sedation as a side effect. Proton pump inhibitors require a prescription from a doctor. Eradication therapy is not indicated for the treatment of heartburn on its own. Listen to the voice note on indications for gastroscopy, or if you need more information on gastroesophageal reflux disease, listen to that podcast on students of surgery. Indications for gastroscopies. Gastroscopies can be either diagnostic or therapeutic, or both. A diagnostic gastroscopy is indicated for the investigation of alarm symptoms or red flags, which include signs of upper gastrointestinal tract bleeding, iron deficiency anemia, dysphagia, unintentional weight loss, and heartburn that does not respond to conservative treatment. They are also indicated in patients presenting with complications of reflux, such as hoarseness, a chronic cough, and recurrent lower respiratory tract infections. It is important to note that most patients with heartburn do not require a gastroscopy. A therapeutic gastroscopy is performed when the patient has a diagnosed condition which requires an intervention or follow-up. For example, an esophageal stricture which requires dilatation or a stent to be placed, or a per-oral endoscopic myotomy for patients with achalasia. If a patient asks you what will happen when they go for a gastroscopy, you should tell them the following. They should not eat or drink, they should not eat 12 hours before the procedure, and they should not drink 6 hours before the procedure. They will be given a mild sedation during the procedure, so they should make arrangements for their transport home as they cannot drive afterwards. In the endoscopy room, they will have the back of their throat sprayed with a local anesthetic, which has a bitter taste, and they may drool saliva for a few hours after the procedure. They will be asked to lie on their left side, and a bite ring will be placed into their mouth so that they cannot bite down onto the scope, and it will also protect their teeth from the scope. The doctor will introduce the scope into their mouth and slide it over their tongue and ask them to swallow to get the scope past the pharynx into the esophagus. Thereafter, they will know that there is a hard feeling pipe in their mouth, but know of little else of the procedure, which usually takes 5 to 10 minutes. It takes longer if the doctor needs to perform an intervention. Once the procedure is completed, the doctor removes the gastroscope and the bite ring. They may notice drooling or have a numb feeling in their mouth or a hoarse voice. This is from the local anesthetic spray, which will resolve spontaneously within a few hours of the procedure. The treatment of heartburn. It is important to realize that there is a difference between heartburn and gastroesophageal reflux disease, or GERD as it is abbreviated. Heartburn is a mild, occasional burning sensation that is felt in the middle to lower chest. It is often associated with meals or lying down. It is short-lived and usually easily relieved with conservative measures and sometimes medication. GERD occurs with chronic acid reflux. Initial symptoms are like heartburn. They are just far more frequent and more severe. Patients may also present with complications such as a chronic cough, asthma, and dental caries, etc. Some say that if a patient has heartburn more than 3 times a week, they must have GERD excluded. Treatment for heartburn consists primarily of lifestyle modifications, which should always be adhered to by a patient, and most will not re-experience recurrence of their heartburn if they follow these measures. The measures include eating smaller meals, not eating within 2 hours of going to bed or taking a nap, avoiding foods and beverages that cause the symptom, to eat slowly, to not smoke or vape, and try and maintain a healthy body weight. If symptoms are worse with lying flat, it is advised to raise the head of the bed by 10 to 15 centimeters. Medications are available over the counter and are only required occasionally, and if required regularly, the patient should be referred for investigation of whether or not they have GERD. The medications include antacids, which bind to gastric acid and thereby neutralize it. These include saccharin, such as medications commonly called Alsanic, aluminium hydroxide gels, examples of which are Gaviscon or Amphagel or even Adco Myogel. And probably these 4 medications which I've just named are the most common and effective when used. There are alternatives, such as calcium carbonate, sold as calcium carbonate, and magnesium hydroxide, also known as milk of magnesia. Side effects of all of these medications are few. However, with chronic aluminium use, there is an associated constipation, and with chronic magnesium use, there is an associated development of diarrhea. If any of these medications are used chronically, the patient must be investigated for GERD and referred for an esophageal gastroscopy. Medications which reduce the amount of acid in the stomach include histamine antagonists and proton pump inhibitors. But proton pump inhibitors, or PPIs, require a prescription, whereas antihistamines are available over the counter. Examples of H2 blockers include cimetidine or Tagamet. This drug has several side effects, but the most noteworthy ones include confusion, especially in the elderly, and loss of sexual function in younger adults. Hence, it is very rarely used nowadays. Proton pump inhibitors include esomeprazole, or commonly called Nexium. Omeprazole and lansoprazole are some of the other ones. Compared to H2 blockers, PPIs take several days before they work, and their effects last for approximately 7 days after the last dose is taken. Side effects include an increased risk of fractures due to decreased calcium absorption and the development of osteoporosis, the development of Clostridium difficile diarrhea by changing the gastrointestinal tract flora, and pneumonias are more common because they altered gastric flora. PPIs should only be reserved for patients with confirmed GERD.